And I think one point to emphasize is for patients diagnosed with cancer today, the 5-year survival approaches 70%. And so, being a survivor decades ago was considered highly unusual. That's no longer the case.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. When it comes to cancer, early detection can mean the difference between a cure and a lifetime of treatment. In this episode of Living Real Change, we sit down with Dr. Walter Curran, Chief of Oncology at Piedmont Healthcare, whose decades of leadership have helped shape Piedmont into a worldwide destination for cancer care. Dr. Curran shares practical advice on prevention, the importance of routine screenings, and how personalized care can make all the difference. This conversation is about taking action, raising awareness, and supporting a healthier Georgia, one person at a time. There are two topics I really want to get into, especially in the last year, been touched with a couple of family members and close friends being impacted by cancer, and it's the idea of really kind of that prevention and that early detection piece, and then for those that kind of get through the treatment, and you referenced it a little bit earlier, what does survivorship look like? So maybe you could talk a little bit about lifestyle choices or behaviors that might help prevent cancer. And then we'll talk a little bit about some of the early detection pieces.
Yeah, thanks, Lacey. Yeah, the more we learn about cancer, we realize there's probably two fundamental elements of what influences which of us get cancer. One are some genetic susceptibilities, which are probably built into whatever we inherit from our parents and our families, with
Sure.
just greater susceptibility of some of us to develop cancers. And then there's the environmental factors of cancer development. And they interact with one another. You can have a susceptibility to an environmental risk. And the greatest environmental risks for cancers include exposure to tobacco, exposure to excess calories and obesity, and also environmental factors that can include air pollution and other contaminants in the air we breathe, water we drink, food we eat.
And I have to ask you about alcohol, though, Wally, because that's been the latest thing this year. Kind of what's
the next one is alcohol, and then the final one is, for lack of a better term, kind of mental health well-being. And and people use the word preventable, but I think there's so many sort of just well-ingrained lifestyle factors that people who have issues with mental health well-being, people who have issues with obesity and diet choices, will not consider those to be habits which are easily undone.
Sure.
The reality is, I think we all can pretty clearly define what is a healthy lifestyle which reduces the risk of cancer. There's no such thing as a healthy lifestyle that eliminates the risk of cancer, but we can reduce the risk. But we also know that, and everyone knows people who have been heavy tobacco users and never developed cancers such as lung cancer. And we know people who've never smoked who develop lung cancer. So all of these are all relative risks, but there's no question that if you look at populations with a healthy lifestyle and populations with less healthy lifestyle, that the risk of certain cancers is greater. And as you mentioned, Lacey, alcohol has been more recently identified as a risk factor for, I think it's up to now 10 cancers, the most prominent being breast cancer and colorectal cancer. And there's the definition of a level of usage of alcohol, which doesn't put you at higher risk, is pretty low. You know,
Like almost nothing.
sniff the wine or something like that.
I wanted to ask you just this genetic piece because I think sometimes we think that if we've got a genetic risk factor, it means that fate would take us down this path where we're going to end up with cancer. And what I heard in your comments was really that it's not necessarily a predefined path. It's the risk is higher, and it in part may relate to how your genes interact with the environment or other types of risk factors. So even if there's genetic risk for cancer, there still may be some things that an individual can do to help reduce the risk of developing cancer.
Yeah, absolutely. And the other thing that such an individual can do is more active screening. And there are people who are identified to be at genetic risk for, let's say, breast cancer or ovarian cancer, who choose to have preventative surgical procedures, including removal of ovaries or removal of fallopian tubes after childbearing years, or preventative breast removal, mastectomy as well. So that, and the reality is the removal of ovaries and or fallopian tubes in the post-childbearing age for high-risk women is actually now really being more thoughtfully considered by more women than previously. So that's an aggressive approach, obviously. But the other approach is to have more frequent screening, be that blood tests or imaging of some type.
So I was reading a little bit about different types of cancer, early detection methods that seem to be pretty effective, how they impact their survival rate. And to be honest, I was surprised that we really don't do a very good job with screening for things that have treatment options. So you mentioned breast cancer, I'm guessing, is one of the ones that we probably do the best job with early screening, but things like colon cancer, cervical cancer, lung cancer detection, where the 5-year survival is drastically different if you catch it early. And even colon cancer, I saw, better than 90% survival if you catch it early.
Yeah.
But our screening's not so good. Any thoughts on why?
Yeah, well, it hasn't been probably the priority it needs to be in both the lay world and the medical world. I will say that one of the great strengths of Piedmont Healthcare is a extraordinarily strong primary care network across our state, and really a commitment on the part of primary care physicians to really set standards and really build them into our electronic medical record, so that it really becomes somewhat automatic that if someone has a risk profile or reaches a certain age, that there's really a clear emphasis on that patient needing to get to, for example, colorectal screening, or if there's a defined history of either family history of lung cancer or smoking history, to get to lung screening. So I think we're proactive, but the screening rates are disappointing in this country, and it has to be a higher priority, absolutely. And there are global efforts that are ongoing on this. Another example, Lacey, of a important initiative where Georgia is lagging behind is, we know that cancer of the cervix, the uterine cervix, is, as well as certain cancers around the tongue and tonsil, are associated with the development of human papillomavirus, or HPV. And that now the American Pediatric Association, the American Family Medicine Association recommend that somewhere above age 10, but before age 14, all of our children should be inoculated against HPV virus. Uh, that is happening to a variable degree, and if you don't happen to get it in your early teens, that you should get it later in life because it is a transmittable virus, which unto itself is typically not a serious illness causing virus, but its latency can put us at risk for cancer of the tonsil, cancer of the back of the tongue, or cancer of the cervix in women. So you can actually argue that cancer of the cervix, if we had successful inoculation, would become a rare disease in this country and could almost be eliminated.
Why do you think this is so challenging? Um, and where do people start? So I can imagine there's some people that have primary care doctors. They kind of get the annual check-in with recommended screening exams, and some people fall through, some people don't. But they're probably I think a lot of people these days that if they've been healthy for a long time,
Hmm.
they don't see a
Yeah,
primary care doctor until they have to. So if I'm listening to this conversation, how should I start to think about screening for cancer, and
right.
what's the right way to start?
So one of the approaches one of our primary care leaders has taken, let's say in colorectal cancer, there's a avoidance, for lack of a better term, of colonoscopy by many otherwise mature, emotionally stable adults, and people are willing to push it off as much as possible. And there are simple tests which just involve no procedure, but actually having a at-home test that can be done, which is quite sensitive, a little less specific. And one of our very pragmatic primary care leaders said, uh, "We we do not have to have perfect screening to have better screening. So if half of my patients fail to agree to colonoscopy, I want them to get this home lab test." And so, even if it would be 5% better for them to get colonoscopy, better to be screened in some way rather than wait for the perfect screen. So I think pragmatic approaches like that are helpful. Um, and I think that, the one of the other challenges sometimes is that availability of screening is not always convenient. Not every insurance company pays for the screening as part of our subscribers' subscription. So there's obstacles like that, and people, I think, feel like they're already going to the doctor for the things that they
Hmm.
have problems with. They're not interested in looking for new problems.
Is it so that example that you gave with colon cancer screening, where they have kind of multiple tier options? I think even the beginning in a fecal occult blood test to the Cologuard to the colonoscopy. Is it fairly common that with each of these types of cancers, there may be more or less, we'll say, invasive or procedural type options? So as to suggest that maybe I don't want to do
Yeah,
a screening CAT scan for lung cancer, but I'd be willing to do something else. It may not be as good, but it would be a starting point. Is that
yeah,
is that a common approach?
yeah. There's not as many good examples of that, Lacey, as there are
Okay,
in colon cancer. I mean, chest X-ray is not very reliable
sure.
and there's really no good blood test for lung cancer screening. Breast cancer self-exam is better than no exam. Doctor exam is better than no exam. But mammography can pick up things that no exam can pick up. So, but exam is better than no exam. And there are people who, for example, men who may not go for the blood test to detect possible prostate cancer, the PSA test. If, on the other hand, they go to the doctor and get a manual prostate exam via rectal exam, that's still better than no exam. So I think those are good examples of what we're talking about.
So for those listeners who may be hesitant or overdue for cancer screening, what message would you share with them?
Yeah, yeah. I think you'll find your provider, your doctor, the nurse, anyone you speak to, your pharmacy. There's no judgment uh, on the part of something not being done 5 years ago or 10 years ago. We all begin our life today, and there's none of us who haven't been a bit late in some of the screening work. So there's no judgment on that. But I think for your peace of mind and for your family's peace of mind, get in a regularly scheduled pattern of screening. And there aren't that many. Um, for people who are at risk for skin cancer, and that's really any of us who have skin, your own exam of yourself is good, but make sure a medical professional does it at least once a year. And if you notice something that's different in the change, a bleed, a new bump, have someone see it. And what's now happening is sometimes it can be seen where you take a photo with your iPhone and send it to a dermatologist, and he and she can say, that looks fine, or you need to come in. Uh, any woman above age 40 should discuss with her provider when to start mammography.
Mhm.
And the same would apply to colon screening. Uh, and again, if you have children who are 10 or older, make sure that your children's providers talk to them about HPV vaccines.
I never considered doing the annual skin screening until I moved to Georgia, and it was probably the first conversation with my primary care was, "You need to go. There's a lot of sun here,
Yeah,
and things change. Everybody's got to be worried about it." So, thank you for mentioning that. Um, I want to talk a little bit about this notion of cancer survivorship. Something honestly I never really considered until my mother went through breast cancer treatment, I think about 12, 13 years ago,
hmm
that there was this other side that people still had to, continue to live with and sort through and think about. So could you maybe define cancer survivorship, and then we can talk a little bit about what that means and things Piedmont is doing?
sure. So right now, the current definition of what it means to be a cancer survivor, it really begins with diagnosis. So once you're diagnosed with a cancer, which requires medical attention, you are a survivor, whether you're still undergoing therapy, deciding on therapy, or whether your therapy ended 10 years ago. So it's a broad definition,
Hmm.
and as you can imagine, it includes many people. Some people with really a very serious medical situation, which is at high risk for them over the ensuing weeks or months, or someone who had an episode 20 years ago but is in follow-up. So it's a broad group. It's estimated that there are, as of today, up to 19 million people who meet that definition in the United States. So that's about 5% of the population. That's larger than the population of Georgia. And it's estimated that the number in 2040 will be somewhere in the 40 million range. So,
Sure.
um,
If we keep doing a good job with the treatment and early identification, we'd hope to have a lot more.
yeah, so it's a large group. And, I think there's all kinds of challenges with them. Uh, One of them, particularly for people who are still under active care, is how does the diagnosis of cancer uh, relate to their work responsibilities and the workplace? There was actually an interesting project just finishing up between Leadership Atlanta and a group called Georgia Core, which is a statewide group of cancer providers. I serve on the board, and we had a presentation from that project where it really has involved activism to make sure cancer patients, as well as their supporters, their spouses or other significant others, make sure that appropriate consideration of their special needs are provided by the workplace, uh, that they're allowed to continue their health insurance, they're allowed appropriate leave, but when they're back in the, and if they want to work, that there's flexibility to allow them to get their appointments and care and so forth. So that's a huge issue for those survivors during their years of care. And I was very pleased at the fact that this project under Leadership Atlanta actually had great legal support as part of the platform, and the partnership between Leadership in Atlanta and Georgia Core want to be a resource for all of us when we have patients and families dealing with these issues, which is great.
That is great.
The people who are post therapy and in follow up care are really generally being followed to make sure that there's not a reoccurrence of their cancer. But depending on the type of cancer they had and the type of therapy, they may need also follow up for dealing with long-term effects of their therapy.
Yeah, and I think I'm noticing maybe some parallels in the type of recommendations you had around uh, environmental things and habits that can prevent cancer, as well as those that help people
Yep.
post-cancer treatment in terms of kind of overall mental health well-being,
Right.
physical activity, nutrition. So kind of interesting that those habits really kind of serve us in a lot of different ways.
And I think one point to emphasize is for patients diagnosed with cancer today, the 5-year survival approaches 70%. And so, being a survivor decades ago was considered highly unusual. That's no longer the case.
What are some of the kind of physical or emotional issues that cancer survivors experience that are treated at these types of centers?
Yeah, I would say the number one acute issue is probably fatigue, and also sort of kind of loss of vitality, which is why exercise is so critical, and it's also why exercise is so critical during therapy. And part of it has to do with the fact that sometimes getting the news is paralyzing, and then you're so focused
Yeah.
on all the scans, all the, hurry up and wait, imaging, go to see this doctor, that doctor. You don't really have the peace of mind or the time or the energy to still do whatever exercise regimen, whether it's walks or some exercise at home. So people kind of lose their fitness level, and then it kind of becomes a spiral of inactivity, inertia, and loss of energy. So getting people their vibe back probably is almost the most important thing.
These services that you're talking about, Piedmont offering, sound pretty comprehensive and yet personalized, which is pretty neat.
And I think one point to make is that a lot of this would not have been possible without the generosity of our donors.
Of course.
The Chapman family, Thomas and Karen Chapman, have been extraordinarily committed and generous.
That's great. I just have a couple more questions for you. The first is, well, I guess you can consider them together. What advice do you have for patients and families navigating a cancer diagnosis? And then the second part is, what gives you hope about the future of cancer care?
Sure. I think the main advice I would give to cancer patients and their families is don't be afraid to ask questions. Don't be afraid to challenge. Don't be afraid to get second opinions. Don't be afraid to be scared. Get people to talk to. And also, the caregivers, don't be afraid to take time out to take care of yourself. And don't hide things from the patients, because they know what's going on, and they know when you're hiding it as well. I think it's, and also be prepared for an evolving pathway. Cancer care is rarely a straight line.
Sure.
Whatever was outlined to you on day one, I can guarantee it's going to be different by day 30, if not day 2. And that doesn't reflect the competency of the team caring for you, but it does reflect the complexity of the care and the fact that new information might change the pathway. Uh, make sure you're with the team you trust. Make sure you're able to speak directly with them, and make sure it's a team that if you speak directly with them, they can, uh, they can handle it and respond. Uh,
I, I'm not an oncologist, obviously, but I always like to add in just to, bring your own advocate, because
yeah,
you just talked about the complexity. It's always good to have a second person listening to the conversation.
yeah, absolutely. And it's okay to be afraid.
Yeah.
That's natural, and it's okay. It's okay to be angry. It's okay to be uh, frustrated. Taking care of yourself during the time is critical.
And what gives you hope about the future of cancer care?
Well, the types of cancers that I know most about, our knowledge on what causes it and what can thwart it, uh, literally changes every year. And there's so many new promising breakthroughs, uh, more for some types of cancer than others. But again, the leading killer, Lacey, in this country, in terms of numbers, and any country, remains lung cancer. And that's despite the fact there's been dramatic declines in smoking rates, uh, particularly in the US, but also around the world. But it's still the leading killer. But what we know and how we can make huge inroads in improving survival is just amazing. And if you skip 1 year going to some of the conferences in lung cancer therapy, you feel like you've missed 10 years because things are moving so fast. And so that gives great hope. The progress in some of the other cancers, lower, but I remain confident that based on the knowledge we have, we're going to see acceleration of care in those areas as well.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.